My name is Andrew Sherman, and I'm Chief of the Department of Cardiovascular Surgery at St. Joseph's Hospital, which is part of the BayCare health system. One of the procedures that we've gained a lot of experience with at St. Joseph's Hospital has been the hybrid approach to the treatment of patients with persistent atrial fibrillation, the end contact convergent procedure. The electrophysiologists were doing a lot of work in a very difficult to treat group of patient population, the patients with persistent atrial fibrillation. We as surgeons were over here doing some minimally invasive type of procedures, and all of us were having okay success, not the kind of success we wanted to have for that group of patients. So what we did is we were able to get together, and there was this procedure called the end contact procedure that they could do, the electrophysiologists could do the things that they were best at achieving, such as isolating the pulmonary veins with, in our particular institution, cryoballoon ablation. And some of the endoscopic surgical techniques to get to areas of the heart that was difficult for the electrophysiologist to get to, we can do fairly easily and safely within the operating room. And once we got together, where I do a portion of the procedure, we map out the heart and make sure that I got to the areas that I wanted to get to, and the areas that our electrophysiology colleagues can get to. Once they're finished mapping that out, we make sure that we have a much fuller lesion set to try to not only treat the patient's atrial fibrillation, but our hope is to cure their atrial fibrillation. And that's a very difficult to treat patient population that nobody's had much success with. And in our experience so far with this procedure at our institution, we've had some very good success rates with. In terms of the patients that are best suited for the end contact convergent or hybrid maze procedure, the way the Institute is set up in terms of the ability to collaborate with our electrophysiology, our cardiology, and the cardiac surgery, all our colleagues together, that is the way we determine what patients will be candidates for this. There still will be patients who will be best served by the electrophysiologist. There will still be patients who are best served by just a surgical approach to atrial fibrillation. But the ability to all get together, discuss each of the individual patients, and not only to be able to discuss them, but have multiple opinions, that allows for us to choose what patients we think can most gain the benefit of that hybrid type of procedure. And that's where our institute is uniquely set up for that ability to communicate, collaborate, and then express to patients a decision or what we think may be their best treatment plan or treatment option based on a number of different opinions, not just based on what I tell them or based on what their primary physician tells them, but based on what a group of 10, 15 physicians who have all thought about their individual care thinks about them. So that the one common goal between me as a surgeon and St. Joseph's Hospital is that we are trying to make sure that every patient leaves here satisfied, safe, with a better quality of life, hopefully a prolonged life, and that all of them leave satisfied enough with their experience here that they tell their family and their friends that this was something that they were proud of and that we're proud of.